mobility-wise, opening up that channel, it's actually between the metatarsals, which are the bones down the length of the foot. So I've got my thumb between the metatarsal underneath and 2 fingers between them over the top, and then giving them a little wiggle to try and increase the flexibility here in the foot. That will help the shoulder blades. Lovely, Laura. You're back.
Back again.
Yeah, so you were here 2 months ago.
Yeah, so.
And baby was then how old? Coming up to 6 months.
Yeah, that's it. So he's just turned 8 months.
Okay.
We're now doing the juggling of nursery and back at work, which is proving challenging.
Apart from what you've just said, how are you? What else is going on?
Really, that's the main thing. I mean, I feel pretty well in myself. I'm sure I'm probably tense all over just from running at that sort of level of kind of running at 100% all the time.
So last time you were here, you had 4 15-minute segments of lots of releases, including reflexology, and we did a cranial and neck release and also a trauma release.
Yeah.
Partly because of the birth and the needle, the memory of the needle during the birth. How were you and are you after all of that?
Yeah, it definitely feels better in that I don't get that same sort of sensation that I was getting in my back when I sort of think about the trauma. So it's definitely an improvement. There's still like a little bit there, but it's definitely a huge improvement from where I was before.
Good. And neck and cranial's feeling better?
Yeah. Again, it's just, I guess because I'm now back at work, I have a bit more time to just try and sit properly, improve my posture, relax a little bit at work where I'm not constantly sort of bent over, sitting on the floor, playing, feeding, you know. So yeah, definitely an improvement from last time.
Yeah. Good. Excellent. Nice to hear. I know everyone were asking, so they'll be pleased to know that you felt better and the treatment worked.
Yeah, definitely.
Okay, so we're doing a whole hour of reflexology today, and I'm going to have a look at your lovely feet and see what comes up. I'll make some notes as I go. So you're having a proper reflexology today, and what normally happens is I'll spend a few minutes assessing the feet, seeing what comes up, and then I'll pick some essential oils. We'll kinesiology test them, which we didn't do last time.
No.
Kinesiology test to see which your body wants today. Are you still breastfeeding?
Yes.
Okay, so I need to bear that in mind. And then I'll blend them and mix them ready for the treatment part of the reflexology.
Great.
That sound good?
Yes.
Lovely. So I'm just going to get some hot cloths to clean your feet. Okay, just giving them a clean off. I'm using some orange blossom hydrolat water. Lovely. Got nice varnished nails. How's your sleep, Laura?
Up and down. So we generally have sort of 2 wakes a night, I would say, which seems manageable. I mean, I love my sleep, so it's worlds away from what I would like.
Okay, so yeah, I'm just going to have a look at your feet now. So I'm starting on the solar plexus. Last time you had the reflex, I know it was only 15 minutes. Did I explain how it all works?
I think you did a little bit, but I'd like to hear it again anyway.
Yeah? Okay. So this is the thing that people really try and have maybe a bit difficulty understanding. So how it works is it's working on energy lines. So these energy lines are called meridians, and they pass through the body, inside and through the body, and end up at the extremities. So at the feet, at the hands, and at the face and the ears. Hence why ear seeds work as well. And when we press particular points, so I'm just going to be pressing mainly with my thumb pads, that might give you a signal that there's a congestion in that particular meridian energy line. If there's a little bit of pain there, or numbness, or a sore point. For me, when I'm touching those areas, I can feel like a solidity, or there's lots of different sensations. I've been doing it a lot of years, so it's really difficult to describe some of the sensations. It could feel a little bit hot or particularly cold to you. It could feel numb. It could feel gravelly, like there's granules, like sugar granules in there. Sometimes it can feel like quite a sharp pain, like deep within the foot, not on the surface. It's an interesting sensation. And I can feel those sensations. I don't know how, but it's just a number of years. And so that tells me, so for instance, if I was to touch here, then that would be your left kidney. And that's because that meridian that ends exactly there is going through your left kidney.
Ah, okay.
Yeah. So if it's impinged for any reason, if the blood flow isn't good to it, if you're not getting enough water in your diet, then that's why the kidney will say, I need a bit of extra help.
Yeah.
Yeah. So when I'm finding areas, I'll be writing them all down, and I'm going to check each system of the body in turn. For instance, glandular, nervine, skeletal, and if I find anything, I'll write it down, but you're very welcome to tell me about any particular sore points. And then I'll concoct some essential oils, with you.
Yeah.
So I'm going to start off on the solar plexus. So I'm detecting a little bit more solid on the right-hand side, and I don't know if you can see the way your feet are lying. I don't know if it's, obviously I've got my core therapy head on as well. It might be the way your hips are sitting, but you can see this foot is coming up, and this one does feel a little bit tighter. I am being picky, but I'm looking for things, because that's why I love reflexology, because a lot of it is preventative. It's not just treating obvious things like a trapped nerve in your back. So I'm looking for the tiniest of things to work on. So that's definitely tighter there. So the solar plexus is here. It's all to do with how we feel, whether we're having a good day or not, whether we're particularly angry or stressed, or whether we're open and happy and go with the flow. A lot of it is how we feel about ourselves. Yeah. So it's a chakra. It's the largest of the chakras, and it's a yellow colour. So often when I'm working on it, and maybe I'll tell the client, will visualise a beautiful golden yellow sun, for instance, at this zone to help heal it. Yeah, and that would work. So moving on, so that was the solar plexus. I'm now going to look at another nervine area, which is the sciatic nerve, which comes from the lower back and splits. So there's a little bit of pain there. Yeah, interestingly, it's now switched feet, so it's now on the left-hand side, and then it travels through the buttocks and down both legs, down the outsides. So that's just a little bit. I can still feel it there, but it's not as bad. Often just by doing the assessment, sometimes it's treating it as well. So by the time I come back to it, it's not a problem anymore. Okay. And looking at skeletal. So starting at the very top of the spine, which is actually right up in the head. Lovely. So the foot's moving nicely. or a little bit tight there. Can you feel that?
Yeah.
That feels sore. Yeah. It's a very localized area. So it's not here and it's not here. It's just here. Yeah. So that's your lower thoracic, just below the bra line.
Okay.
Yeah. It's not as bad on that side. Lower back maybe. Oh, a little pop there. Yeah. Okay. So I'll definitely be treating the spine, but it's going to be, obviously you're carrying a lot at the moment, aren't you?
Yeah.
Holding him a lot and feeding. So looking at neck. That's tight, especially right on the back.
I think you brought that up last time as
Oh,
well.
did I?
Yeah.
Yeah, people watching will be saying, yeah, you did. Yeah. Yeah, it's mainly there, back of left side. Okay. Then scapula, so that's the left shoulder blade. That feels good. I'm pleased about that. Oh, a little crunch on the right, lower down. And then shoulder point, so you've got some hard skin here. So that tells me there might be some congestion there. Yeah. So that's about here
Okay.
on the left shoulder, lower down on the shoulder point here. Yeah, because that's where the dry skin is. Does that feel sore there?
It doesn't feel sore, but
No.
it feels sort of tighter.
It's crunching now. Can you feel that?
Yeah.
Yeah. Okay. Oh, pigeons are giving us a chaperone. Let's look at joints. So elbows, hips. Hips feel good.
Yeah.
I'm pleased about that because
Good.
of childbirth and carrying
Yeah.
him. Awesome. How do they feel to you?
They've always been generally quite tight, but I would say they don't feel sort of any worse than they have done
Okay.
historically. They're sort of pretty stable at the moment, it feels.
Dare I ask, are you managing any exercise? Not really. No, you don't have time. Okay, so I've done skeletal, I've done the joints. Going to have a look at digestive now. So starting on the liver. That feels fine. That's nice. And the small intestine. Little bit tight there. Ileocecal valve, which is the valve between the small intestine and the colon, coming up the ascending colon. Transverse, they feel fine. So coming to the small intestine first, a little bit tight, but that could be because you've just had your dinner.
I've had a banana in the car.
Oh, is that it?
Yeah.
When are you eating when you go home?
Yeah, when I get back.
Oh, wow. Okay. It's the banana then. And then coming round transverse and descending colon, Houston valve, rectum, and then stomach and spleen. See, they're all really good. They're lovely. I'm just making a little bit of a note for the small intestine. Leave room for dinner. And respiratory. Let's have a look at those lungs. And of course, you've mentioned about getting bugs and things, so lungs can be affected. You've got some dry skin here, which might be impinging the lungs a little bit. They are over that area and over the thyroid. They don't feel bad at all. Sometimes with lungs I feel like a crunchiness in them or a blockage or solidity. Don't feel that, so that's good. Looking at the sinuses. They feel good.
Okay, good.
When was your last sinus? Did you, because you've said you've had a couple of bugs from the nurse, from him going to nursery. Was one of them a respiratory bug?
Yes.
And how long ago was that?
I've probably still got the remnants of a little cough from it.
A cough. Right.
Yeah,
okay.
maybe like started 2.5 weeks ago.
Oh, gosh, it does linger then.
Yeah.
Okay, well, I can't feel it in the lungs.
Good.
So I'm just looking at the eyes. I don't know if you can feel that. So the right eye is clicking a little bit. And it's coming down here as well.
Yeah, I can feel it now.
It's quite minimal, but I am, as I say, looking for everything. And then ears. So immediately both of them are really crunchy.
Yeah, I can feel that.
Sometimes it's just one, but it is both here. Yeah, okay. Right, we will definitely look at that. It's good that you came. Okay. And so that was respiratory, eyes, ears, sinuses. Let's have a look at your immune system. So coming into the immune system, the little factory that's in the chest. This is the cervical lymph. A little bit. So I don't know if you can feel halfway down there's a little lump. It's like a thickening there.
Yeah.
So it feels clear there. Then there's a thickening.
Yeah.
Then it feels clearer. Yeah. Yeah. And then this is the inguinal lymph, which is in the groin area. And that, so this takes infection and trouble away from the upper part of the body, and this one's the lower half of the body. Yeah. So I'm just working around the inguinal lymph. So when was your last stomach bug?
About 5 weeks ago.
Okay. A long time ago. I can't feel any problem there at all. It's not swollen. I can't feel any crunchiness or pain.
No, no pain from me.
Good, okay. Presume periods haven't restarted.
Kind of on and off.
Really?
So I keep thinking that they're starting, get a little bit, then it doesn't really result in anything.
Yeah, so I'm just having a little feel of the ovaries coming over the fallopian tubes to the centre where the uterus is located. So left and right sides of the uterus feel quite different from each other. I don't know if you can feel that.
Yeah, it feels sore on my right leg.
So this has no technical term, squashiness to it. Okay, so I feel like I'm feeling straight to it.
Yeah.
This has like a layer of gel duvet over it. That's how it feels. Yeah, like it's protected. So it almost feels like there is a thickening to the left side of your uterus at the moment, and the right has no thickening, you know, of blood capillaries. Whether that's the case, you know, you'd know in the next few days. So, yeah, I can definitely feel that there. So uterus, ovaries felt fine. And yeah, pituitary. So let's look at the glandular system. So the pituitary is here. And the pituitary governs the release of all the hormones of the body, not just reproductive, but everything. And it feels fine. And then the pineal, which is our sense of time of day, time of year, where we are in the world. So those people that have to, work nights or up at night, that affects your pineal gland. Yeah. So that does feel a little bit tight, actually. I don't know if you
I can feel it more on my left than my right.
Interesting. Okay. Yeah, so I'll definitely work on that. Pineal. And thyroid. So this is more on your right foot where the hard skin is just here.
Yeah.
It was going over the lung a little bit. I don't know if we talked about whether I recommended to you getting a little handheld exfoliator or using some exfoliator cream So I would have a look at this one.
Okay.
It's not really on your left,
No.
it's just quite isolated.
Yeah.
And then on your left outer here and here. So far I've noticed it just in 3 local places. They're quite small, but it is worth getting rid of.
Okay.
And you'll find that walking will be better, your foot position. You may even subconsciously not know that you're walking differently, but without it you'll walk better.
Okay.
You see, heels aren't bad, not much dry skin. Yeah, great. So it's just those 3 main areas, really. Yeah, a tiny bit there, maybe. I don't know. You're probably aware of that. So whether it's your footwear or the way you're walking, obviously our hip position can affect our feet. So in core therapy, I'm often looking at hips because that's going to affect the way we're walking in our footwear. And with kinesiology, we can test the shoes to make sure they're supporting you correctly. Okay. Yeah. I had a lady in today and she said her footwear is probably not the right footwear because her feet were rubbed in particular areas, and she said it's going to make her look at it, whereas without me mentioning it she'd have just not even thought about it. So it's good sometimes just to have a check and balance. Right. So thyroid, the only reason I'm going to make a note of that is because of that dry skin there. I do want to give it a treatment. And lastly, the adrenal glands, the kidneys, the ureters, and the bladder. And they feel great.
Good.
And it's hardly ever that I say that to anyone that comes and has reflexology. Very rare I say that their urinary system are clear. I will still treat it because the reason we treat it, and we treat it at the end of a reflexology, is it helps detox and clear out whatever else I've got moving during the treatment.
Okay.
Yeah. So great news.
Oh, good. Top marks for that then.
Yeah, not much has come up, but you will feel better after this, and I'm hoping it's going to boost your immune system.
Yes.
Okay, going to have a look at some things that will help the immune system. So, definitely thyme, definitely, where is it? Cinnamon, eucalyptus, clove, yes, and immune. I did have patchouli. Oh, black pepper. Where are you? Black pepper. Yes. And the spices are often very good. Let's bring in some cardamom, lemon, detox. That's a nice few to work with. Let's see how we go. So, you were just asking about why certain oils might affect my decision making with blending during while you're breastfeeding. So, yeah, I wouldn't want to affect any or choose any that affect your lactation markers. So, because some of them are hormonal balancing. So, similar to if someone was coming in with being pregnant, especially early days of like the first trimester, I'd be very careful with ones like clary sage and sage and geranium and even rose. There are a few others as well, and also with fennel, because fennel is a diuretic, and diuretic means encourages fluid loss. And of course, the placenta is all full of fluid, and all the fluid around the baby, so wouldn't want to affect any of that. Yeah. So, and also fennel, it can be hormonal balancing as well. So that's another reason for not using those particular ones. But the ones I've chosen are fine to use, and actually, these are ones that could be in his diet anyway.
Yeah.
Yeah, like some mild spices and
Yeah.
things maybe. But they are just so good for balancing your immune system.
Okay.
Yeah, yeah. But also, we're going to kinesiology test. So your body will tell me very obviously
Okay.
whether it's not right for me at the moment. Okay?
Yeah, interesting.
So we didn't do this last
We
time.
didn't.
Can you give me a little finger and thumb? Just your other hand off your abdomen. Lovely. I'm going to try and pull apart. You're going to hold together really firm and hold. Lovely. Nice and strong. With the other hand, can you support that in place there so it's touching you? I'm going to try and pull again, just turning your hand slightly and hold. Lovely. So really strong. You can feel that. Yeah. So that is cardamom. And hold. Nope. Okay, that is lemon. So a very different approach, more detoxing. Okay, and hold. Lovely, very strong. That is black pepper, another spice. Looks like we'd like the spices. And hold. Really strong. This is clove bud. Okay, last one. And hold. Really strong. Okay, so we only had one that was quite obviously no, and you'd think lemon would be a yes, but you never know why your body's saying it. Yeah, it doesn't mean to say never have lemon again. It just means you now here with an essential oil for the feet.
Yeah.
So patchouli has come up as well. You've got some nice ones here. So you've got clove, patchouli, black pepper, and cardamom. I'm going to make quite a mild mix because of the breastfeeding, but do you have any preference? I'll use 2 or 3.
No, whatever you think.
Okay,
Yeah.
rightio. So let me put a little of this on your wrist or your hand. Have a little smell, see what you think.
That's nice.
Yeah.
Relaxing, but also quite refreshing at the same time.
Yeah, good. Yeah.
That's nice.
So we've got cardamom and patchouli. Patchouli is a beautiful oil. It's a little bit musky. It's one that men quite like, but I mean, I love it. It's in a lot of perfumes actually, but as an essential oil, it's really good for you. So yeah, help with the immune system. It looks after you. Yeah. And the cardamom at base note, a spice. It's a nice sort of sweet spice. Obviously, it's in a lot of curries and spiced foods. So yeah, lovely for the feet. And then works on the immune system. I mean, being a spice, it's nice and stimulating as well. So it helps boost your immune system, your circulation, respiratory, digestive. It'll just make sure everything's working okay. Yeah. Patchouli is also very good for sleep, so help you sleep tonight.
Nice.
Okay, so do you want to lean back more? Do you want an eye mask? Do you want a covering over you, a sarong or something? Or are you
Maybe
happy?
an eye mask?
An eye mask.
Yeah.
So I've got a choice of two.
Okay.
I've got a hematite, like a crystal one with tiny bits of light through it, so it's not completely black, or it is quite dark. Or I've got a soft herb filled one with rose, peppermint, and lavender, which goes over the eyes and sort of sinks into the eye
That one
sockets.
sounds good.
Yeah, okay, let's do
Please.
that. Okay, so just putting a couple of cotton pads on. So that's got the lovely orange hydrolat, and then the soft eye pillow that just sits into the sockets, giving the nose and eyes and brow a little massage. Okay, does it feel like it's going to sit?
Yeah.
Okay, lovely, Laura. 3 nice long breaths. And then circling, relieving the solar plexus, introducing the thumbs, medium pressure, clockwise, working on the solar plexus chakra. Can feel that accepting and relaxing immediately. And I want to stretch out the spine, so a row of fingers working down the channel to the side of the erector spinae, the reflex zones to the feet, beautiful channel here. And a nice stretch. Oh, it feels so good to put a little pressure on and along the whole spinal canal, especially this area here, just underneath that shoulder blade, giving it a good stretch, and on and over up to the very top of the spine, very top of the neck. It's a little bit tight there. I'm going to definitely work more there. So in the assessment earlier, we noticed that the area here, so it's about T12, thoracic number 12, just below the bra line, was a little bit tight, constricted earlier. This is now already loosening up. I can feel the foot giving and adapting around the touch. And I've got my hands crossed because that's the right orientation to be able to apply the perfect amount of pressure. Right up into the neck, giving the neck a good stretch, holding the toe and pulling gently. It's a little click started in the left side of the neck. And down and round, wonderful. And then up those shoulder blades. Now they didn't come up with any issues earlier, but just giving them a double check. they feel good. And then the shoulder points, holding the foot and then circling with the thumb pad and the thumb tip. So softening that little bit of hard skin that's there. And also, mobility-wise, opening up that channel. It's actually between the metatarsals, which are the bones down the length of the foot. So I've got my thumb between the metatarsal underneath and 2 fingers between them over the top, and then giving them a little wiggle to try and increase the flexibility here in the foot. That will help the shoulder blades. Yeah, it's better already. Just checking my notes for where else needs treating. So let's come back to the neck while I'm up here on the structural system. To the side of the neck and the back. So it's really good that the head and neck are adapting when I'm pressing. It's not solid and stuck and rigid, it's giving nice and softly. Lovely. I don't know if you can hear that, but the birds are definitely giving us a chorus tonight. Mm-hmm. I mean, the sun is still out, but it does feel like it's starting to go a little bit darker here in the UK, even though it's tomorrow will be a month past the longest day. And while I'm here, just feeling into the hips, elbows, knees. Lovely. They were a little bit chilly, so warming them up is nice. Now, respiratory system. Let's look at those ears. Yeah, they're still clicking. Not as bad as they were earlier in the assessment, but so now rather than a crunch, I can more feel like there's a rigidity there. There we are. They are a little bit firm. There's probably a bit sore, so I'm being careful. Lovely circular action. It's nice, the whole foot benefits from even one area being treated because it's adapting, moving, it's enjoying the oil, the patchouli and cardamom. Lovely. And then let's have a look at the small intestine, which is in the middle of the gut. And I'm coming out with both thumbs from the centre of the fleshy part of the sole. So might as well use 2 for a while. Moving the small intestine so it adapts and becomes soft through the ICV, the ileosacral valve, up and across. Repeating. And then small intestine. And then colon, down and across. So the colon felt fine earlier, but if I'm working on the small intestine and the process, then I need to be working on the colon as well, just to work on the onward movement. There we are. Lovely, that feels a lot better. Uterus came up, so let's have a look at that. So that's in the centre, under the ankle bone, more towards the heel point, the corner, using 2 thumb tips. I'm just going to hold that area for a little while. Just tuning into the uterus, the womb. Sending it some lovely female energy. A hug. And the patchouli and the cardamom will help this area so well. I can feel that. It's really nice. And so we've looked at ears. So the right eye came up slightly, which is here, just on the windowsill, if you like, the shelf under the toes, in between toe 2 and 3. I can't feel so much of an issue now. It's obviously helped just by treating the rest of the foot and the assessment itself. And see how the toes are adapting when I'm working on that area. It's so nice to see, rather than being rigid and solid. Might as well look at the other eye. Yeah, so it starts off a little bit firm, but yeah, easily goes soft. Nice, no clicks. I want to look at that lower back again. It did come up earlier. I know I've already looked at it, but I can feel that's a little bit firm. That feels sore there. I can feel it's not much cushioning. And I do want to look at the immune system, of course, cervical and immune, cervical and inguinal. So I'm just going to use 2 hands here because I want to work on this area and stretch the foot while working on the lower back. So it's like soft tissue release when I'm holding the area and then stretching the rest of the limb out in order to give this area, in this case the lower back, an extra stretch. That patchouli is going to be wonderful there. Yeah. And now we need to look at detoxing. So starting on the adrenal. Kidney. It felt fine earlier, but it's gone a little bit firm now. Ureter is good, and the bladder's good. So just that kidney. Lovely. I will come back to it, but just now looking at the left foot, adrenal, kidney, ureter to the bladder. That feels fine. Nice. Yeah, so I just want to give those kidneys a little extra attention. Just going to hold them for a little while with thumb pads. Oh, the sun is coming through to me. It's amazing. It's come through the trees. Lovely. And a little massage before the Brazilian toe technique. Warming up the ankles. The middle toe, just supporting, holding, channeling the energies, helping to balance, enjoying that beautiful settling feeling. And the fourth toe, settling into all of the energies of the body, settling the digestive, the immune, the respiratory. The glandular, the nervine, And the excretory, coming to the little toe. And loving what is. Enjoying every moment. A beautiful feeling of acceptance. And second toe, gratitude. There may be colours that can be seen behind closed eyelids as the energies are balancing. And the big toe. The feeling of joy. Abundance. All through the big toe. And coming to the immune system, around the inguinal lymph, which felt good earlier, but also just giving it a little attention to double check. So around the back of the outside of the ankle bone, and then slightly stronger upwards over the top on the fleshier part of the ankle. This area feels a little chilly, so I'm bringing it some warmth, compassion, some care. That's what the immune system needs. Something to look after it, so someone. There you go, it feels good. And the cervical lymph. So that's between toe 1 and 2, in the fleshy part between the metatarsals, coming from the split of the toes down through the fleshier part. And earlier we noticed there was a little bit of a thickening halfway down here, but that actually feels like it's almost gone now, already. Enjoying that wonderful feeling of a strong, robust immune system, one that can adapt, one that keeps us safe and secure. That feels a lot better. I'm just going to hold it for a little while. Oh, so nice. I just feel so humbled and grateful to give such a treatment from someone in need. Giving the feet some love. Giving the body love through the feet. And drying off the excess oil. It still smells lovely, like cardamom and patchouli. And taking a few deep breaths, Laura. And then slowly sending your breath to your fingers, giving them a little stretch out, widening palms and soles, stretching through fingers and toes. And if you feel like it, rolling through your shoulders. I'm going to come and just remove the eye pillow. It might feel a bit bright at first. Okay. And then a nice long body stretch, bringing your arms up over your head.
Yes, very good. Guys, amazing the sensations that you feel just all over your body, and like you said about the colours as well. Yeah, very relaxing.
Oh, lovely. Good. So I'm thinking the best for you, that you're going to be robust and strong now.
Yeah.
Or at least a lot stronger than you would have been.
Yes.
Yeah. And you're welcome back anytime.